everybody, Dr. Johanna.
I'm Dr. Madeline.
Whoop, whoop. Again, it's not meant to be today. We're your awesome twin chiropractors at Atlas Chiropractic Center
In sunny St. Petersburg, Florida, where we see your whole family, but our jam is pregnant and postpartum mamas, but we do see your whole family. So yes, we see your husbands or your men in your life and your children as well.
Yeah, we see spouses, loved ones, moms, dads, aunts, uncles, you name it. They have a spine, we can keep them in line.
It's our tagline.
Anyway, so today we're going to talk about something a little bit different because a lot of times we talk about, or a lot of people think that chiropractors help with spine alignments, which they do. But when we ask patients maybe if they have other issues, or a lot of times you may hear someone come to the table and say like, I don't think you can do anything, but my wrist hurts, my foot hurts. And I'm like, well, actually, we can.
Yeah. So you're jumping on, say hey, drop some emojis down below. If you're catching the replay, say replay. Make sure we don't miss you. But yeah, we've have quite a few patients who show up, or new patients who are like, well, can you, like, I mean, I just kind of have like knee pain or hip pain. Like, can you do anything about that? So yes, we focus on the spine, but we do learn about your extremities and joints, other joints as well. And at least in this office, we can speak for ourselves. We do address that with you, and we have different tools and techniques to help treat that. So
what would an extremity be?
Extremity would be like your joints. So like your spine is like in here on your back, right?
Yeah.
So we're talking about all your other joints, like your wrist, your fingers, your elbow, your shoulder,
Your jaw,
your hips, your knees, your ankles, your feet, your toes. Yeah. So all of those, we will check them out if there's something going on. A lot of times when you have an issue in those places, it'll kind of actually be like pinpoint pain. Like you'll usually be able to be like, well, I actually have pain there. We can do an adjustment, and usually it resolves pretty fast, which is pretty cool. But there is also a lot of like muscle component as well, especially in like your wrist, forearm region. I find we have to do a lot of muscle work there. And it's pretty common because of
computers, technology, which is where we're at in today's life and what we do. So absolutely, we do see a lot of that stuff, and there usually is muscle component. So we always, in general anyway, no matter if it's spine or extremity joint related, we are always looking at the actual joint itself, in addition the muscles that attach or stick onto that area, because they should always work like a pulley system in unison. And a lot of times when you're coming in with pain or discomfort and mobility, that kind of stuff, they're not playing well together.
Yep, definitely not.
Yeah, they're not friends. So you have to address both aspects, which we can absolutely do, and get you moving and grooving.
Yeah, so I'm talking about like two cases I've just seen recently, so we'll talk through those real quick. And then I wanted to give you, like, because I did this one for tight hips, because I think a lot of people probably experience this, whether they know it or not, because of sitting at the computer and stuff all the time. So I figured I would give you like something you can do on your own after this video to loosen them up a bit.
All right.
So I had somebody come in the other day who was having knee pain, and what I find, at least for a lot of the patients that come in with knee pain, like you can't really describe it. You're like, oh, it kind of like hurts, maybe like here, I don't know, it's kind of hard, it's like deep in there. Just give us what you got and we'll do our exam to try to figure out what's going on for you. But knee pain, this person works in sits all day long at a computer, and then they're also a parent, so they're chasing their little ones around, and then they are playing like recreational sports on the weekends, like flag football, stuff like that. So they notice this knee pain. It like inhibits them from doing their sports as well as they want to. And when I checked them out and did their exam, we did what we call the magic knee adjustment on them, which if you've had it done, then you know. If you're not, haven't had it done, maybe you should ask next time you're here so you can get some magic on your knee. And because you have two bones in that lower leg, we're looking at your tibia and your fibula. So I also checked out the fibular head, which is tiny, but it'll move. And when it moves, like it can be quite painful. So did an adjustment there and was already feeling better before they left the office. So that's pretty cool. And they had that pain for a while. So you don't have to suffer, pretty much. So I'm telling you as well. But pretty common, I think, when we see people sit and then active and like burst in times. Like,
well, that's what I was going to say. One thing I took away from that story that you were saying is that it doesn't come just from an activity, right? So it doesn't just come from like, oh, I was running and I hurt my knee or anything like that. It can come from an inactivity such as being stagnant and sitting because you're not using those muscles that support the joints. They're constricting, they're tightening up, which happens a lot with low back pain with people. You'll hear them say like, oh, I sat down and like I was okay, but when I went to get up, it was like horrendous and it was hard to get up because those muscles are just, they're not working, like they're just resting and they're tightening up as you're doing that. So same thing can happen with those joints. So it can happen from an inactivity too.
Absolutely, yeah. And speaking of happening from inactivity, let's talk about like hip pain, which when I say hip pain, we use that term loosely because people describe their hip as a lot of different things.
Yeah, so we always ask, like, just point to where you're feeling it because you'll get all kinds of areas.
Yeah.
Which is okay.
Yeah. But they came in, again, sits at a computer a lot during the day. So feeling really bad hip pain when they're working out, and then with other activities of daily living, it flares up and it's really uncomfortable. I went to go adjust this person, and if you've ever been in the office and if you've gotten like a low back adjustment, sometimes we lay you on your side and their leg, this area was so tight on them, like I couldn't even get their leg, that bent leg, into position. So I was like, oh, we definitely need to work on this. So I did some muscle work on there for that person, but I also gave them something they can do at home. So I thought I would show you something really quick so you can have a tool that you can work on at home to kind of work on getting your hips just moving, getting those joints loosened up a little bit, and they have like this fluid in there, so getting that fluid moving and grooving for you as well. So I don't know if you want to help me, because we're gonna have to move the camera a little bit.
I was gonna say, how are you gonna get everything in the Zoom?
I don't know, maybe you can just hold it here for me so you can see me on the chair. Okay, bear with me. So you can do this in a chair. You could do this laying flat on your back as well. It's called a figure 4. So you're just gonna take, let's say your right ankle, and you're gonna cross it over your left knee. Okay, and then you should just assess and see what this feels like. If this is too much, then we have some other options for you, and just message us if you need another option. So when you're here though, if it's like a little tight, maybe let it sit there for a couple minutes, or a couple seconds. Definitely breathe through this. And if you can do a little extra stretch, put that right hand on the top of your right knee, and you can push into that a little bit, and you should feel a little extra stretch in that hip capsule. Thinking about your legs here, they have that enter that joint, that they're kind of pushing back just to kind of traction to give that joint a little bit extra stretch. And you can do it that way. Again, you can do this laying on the ground. You would be laying on your back. You would pull it here, and you can actually bring your leg up and pull through it to get a little extra stretch there as well. If the chair is too easy for you, go ahead and lay on the ground and try that one. If you are pregnant, I want to mention, because we've had some pregnant moms do this one, which I think is great. You can find like an elevated surface like your bed or something like that, and you can bring that leg up in front of you and rest it, and you can get that stretch in that hip joint as well, and maybe even come a little bit more forward to pull in that area a little bit more if you need it. So you can put the camera back the regular way. So try that one out if you have some hip issues going on. And cool. Yeah, let us know how it goes. Let us know how it goes. Let us know if you have questions.
Yeah, and if you need more stretches, Dr. Madeline posts them all the time on our Instagram page.
Every Thursday you get some sort of like movement recommendation, so definitely go check them out.
Yeah. All right, until next time.